I want you to look in the mirror. I want you to look at your face, specifically at your eyes. Do you feel like you look tired, even when you have had a full 8 hours of sleep? Do you notice that one of your eyelids seems to be hanging a little lower than the other, perhaps covering a bit of the colored part of your eye, the iris? Maybe you have noticed that in photographs, you are tilting your head back, lifting your chin up just to see clearly, giving you a surprised or haughty expression that you don't intend. Or perhaps, most frighteningly of all, you are driving your car in the evening, and you realize that to see the traffic light change from red to green, you have to physically use your forehead muscles to hoist your eyelids up because they feel like heavy velvet curtains that just want to close. You might brush this off. You might say, well, I am getting older. My skin is sagging. I just need a little nip and tuck. You might think this is purely a cosmetic issue, a vanity problem that can be solved with a little plastic surgery or just ignored. I am here to tell you that a drooping eyelid is not always just a skin problem. It is not always just gravity pulling on loose tissue. It is often a neurological distress signal. It is a sign that the communication lines between your brain and your muscles are being severed. There is a specific condition called Myasthenia Gravis, which translates literally to grave muscle weakness, and for the 60-plus population, it is the great masquerader. It mimics aging. It mimics stroke. It mimics fatigue. But it is none of those things. It is an autoimmune attack on your own nervous system. And if you ignore it, if you assume it is just baggy eyes, you are putting yourself at risk of a crisis that can affect your breathing and your swallowing. Today, we are going to dissect the difference between a cosmetic droop and a medical emergency. We are going to learn the ice pack test, a fascinating, free experiment you can do in your kitchen to diagnose yourself. We are going to talk about the dangers of driving with a limited field of vision. And we are going to explore why your eyelids might be the first clue to a much deeper problem within your immune system. By the end of this video, you will know exactly when to call a plastic surgeon and when to call a neurologist. To understand why your eyelids are falling, we first have to understand the anatomy of the awake look. Keeping your eyes open is an active process. You have a tiny, specialized muscle inside your eyelid called the levator palpebrae superioris. Its only job, 24 hours a day while you are awake, is to contract and hold that lid up against gravity. It is an endurance muscle. It is like a soldier standing guard. When you blink, it relaxes for a split second and then snaps back to attention. In a healthy body, the brain sends a chemical signal, a neurotransmitter called acetylcholine, to the muscle. The muscle catches this chemical in a little receptor, like a baseball into a glove, and that tells it to contract. Lift. Hold. Lift. Hold. It happens thousands of times a day without you thinking about it. But for people with myasthenia gravis, this system breaks down. It is an autoimmune disease. Your body's immune system, which is supposed to fight off flu and bacteria, gets confused. It starts producing antibodies that attack your own muscle receptors. It puts gum in the lock. The brain sends the signal, the acetylcholine, but the muscle can't receive it because the receptor is blocked or destroyed by the antibody. The signal is lost. So, the muscle tries. It lifts the eyelid in the morning. But as the day goes on, as you demand more and more from that muscle, the receptors get clogged. The muscle gets exhausted. It starts to fail. The eyelid begins to drift down. This is the hallmark of myasthenia gravis, fatigable ptosis. Your eyes might be wide open and bright at 8 a.m., but by 6 p.m., one or both of them are half shut. You look sleepy. You look drunk. But you are just chemically blocked. This brings us to the most dangerous aspect of this condition for seniors, driving. We cherish our driver's licenses. They are our freedom. But driving requires the upper visual field. You need to see the traffic lights hanging overhead. You need to see the road signs. If your eyelid droops just 2 or 3 millimeters, it covers the pupil. It cuts off the top half of your world. To compensate, you develop what we call a chin-up posture. You tilt your head back to peek under your own eyelids. This is dangerous for two reasons. First, it causes chronic neck pain and cervical spine compression, which we have discussed in other videos. Second, it slows your reaction time. If you have to mechanically adjust your head to see a hazard, you are losing split seconds. Split seconds are the difference between stopping in time and hitting the car in front of you. If you find yourself struggling to keep your eyes open on the highway, or if you feel safer driving in the morning than the evening, this is a major red flag for ocular myasthenia. But how do you know if it is myasthenia or just excess skin? We need to distinguish between ptosis, muscle failure, and dermatocalcisis, baggy skin. Dermatocalcisis is common. It is the stretching of the skin. The skin hangs over the lashes like a hood. If you use your finger to lift the skin up, the eyelid underneath is usually in the right place. The muscle is working, it is just wearing a heavy coat. Ptosis is different. In ptosis, the margin of the eyelid itself, the lash line, is too low. The muscle has given up. You can have both, of course, but the muscle failure is the medical concern. Here is the ice pack test. This is a diagnostic tool that doctors use, but you can do it at home. It relies on a quirk of biochemistry. The enzyme that breaks down the chemical signal in your muscles doesn't work well in the cold. Cold temperature preserves the signal. It makes the muscle stronger temporarily. So, if you have a droopy eyelid, go to the freezer. Get an ice pack or a bag of frozen peas. Wrap it in a thin towel so you don't burn your skin. Lie down. Place the ice pack over your drooping eye for 2 minutes. Relax. After 2 minutes, take the ice off and immediately look in the mirror. If your eye pops open wide, if the droop is magically gone for a few minutes, that is a positive test for myasthenia gravis. The cold fixed the chemical block temporarily. If you have just baggy skin or a stretched tendon, the ice will do nothing. The skin will still be baggy. But if the position of the lid changes dramatically, you need to see a neurologist. You have just diagnosed a neuromuscular disorder in your kitchen. Let's talk about the +1 symptom that often comes with the drooping lid, double vision. This is terrifying. You are reading a book or watching TV, and suddenly the image splits. You see 2 TVs. You see 2 moons. You close one eye, and the image becomes single again. This is binocular diplopia. Why does this happen with the drooping eyelid? Because the same disease that attacks the eyelid lifting muscle also attacks the muscles that move the eyeball left, right, up, and down. If the muscle that pulls your right eye to the right gets weak, your eyes become misaligned. Your brain receives 2 different pictures. If you have a drooping eyelid and double vision, this is almost certainly not just aging. Aging does not cause double vision. Cataracts can cause ghost images, but distinct double vision plus a droopy lid is a neurological scream for help. Now, we have to look at the other, scarier causes of a drooping eyelid, because myasthenia is not the only villain. There is the brain aneurysm. Specifically, an aneurysm pressing on the 3rd cranial nerve. This is a medical emergency. How do you tell the difference? With a 3rd nerve palsy, aneurysm, the eyelid will be completely shut. It won't just droop, it will be closed. And, this is the key, the pupil will be blown. It will be huge, dilated, and fixed. It won't shrink when you shine a light in it. And you will likely have a massive, thunderclap headache. If you have a droopy eye, a giant pupil, and a headache, call 911. That is not myasthenia. That is a time bomb. But with myasthenia gravis, the pupil is always spared. The pupil reacts normally to light. It is small or large depending on the room. Just like normal. It is purely a muscle weakness issue, not a pupil issue. This is a vital distinction that can save you from a panic attack. Then there is Horner's syndrome. This is a rare but important one. In Horner's syndrome, you have a triad of symptoms: a droopy eyelid, usually mild, a small pupil, constricted, on that side, and a lack of sweating on that side of the face. Why does this matter? Because in older adults, Horner's syndrome can sometimes be caused by a tumor in the lung, a Pancoast tumor, pressing on the nerves in the neck. If you notice one eyelid is a little low, and the pupil in that eye is tiny compared to the other one, you need a chest X-ray. It sounds unrelated, an eye symptom caused by a lung problem, but the body is interconnected in fascinating ways. Let's return to myasthenia gravis because it is the most common cause of variable drooping in seniors. It is often called the snowflake disease because it looks different in everyone. For some people, it stays in the eyes, ocular myasthenia. For others, it spreads. It moves to the throat. This is where the cosmetic problem becomes a life-threatening one. The same antibodies that attack your eyes can attack the muscles of your throat and your diaphragm. You might notice that your voice changes. You start sounding nasal or slurry, especially after talking for a while on the phone. You might choke easily when drinking water. Or you might feel short of breath when lying flat. If you ignore the drooping eyelid for years, thinking it is just old age, you might miss the early warning sign of this systemic weakness. Catching it at the eye stage allows doctors to treat it before it becomes a breathing stage or a swallowing stage. So, what causes this? Why does your immune system suddenly decide to attack your eyes at age 65? We don't know the exact trigger, but it is linked to the thymus gland. The thymus is a gland in your chest that is part of the immune system. It is supposed to shrink and disappear when you are a teenager. But in many people with myasthenia, the thymus stays large or develops a tumor, thymoma. It acts like a training camp for the bad antibodies. Sometimes, removing the thymus gland can cure the disease. Let's talk about the Botox mistake. Millions of seniors get Botox injections to smooth out forehead wrinkles. Botox is a toxin that paralyzes muscles. If the Botox is injected too low in the forehead, or if it migrates, it can paralyze the levator muscle, the exact muscle we are talking about. This causes a temporary, but profound, drooping of the eyelid. It looks exactly like myasthenia. If you recently had a cosmetic procedure and now you can't open your eye, it is likely the Botox. The good news is, Botox wears off in 3 months. The bad news is, you have to wait 3 months. But it is vital to tell your doctor if you have had injections, so they don't misdiagnose you with a neurological disease. Now, let's discuss the solutions. If you do the ice pack test and it is positive, or if you have the fluctuating fatigue, what happens next? You go to a neurologist or a neuro-ophthalmologist. They will do a blood test to look for the antibodies. They might do a specialized test called a single-fiber EMG, where they measure the electrical jitter in your muscles. If it is myasthenia, the treatment is often a medication called mestinon, pyridostigmine. This drug helps the chemical signal survive longer in the muscle. It is like clearing the gum out of the lock. For many patients, taking this pill is like flipping a switch. The eyelid pops open. The double vision vanishes. The energy returns. It is miraculous. For more severe cases, they might use prednisone, steroids, to calm the immune system. But the point is, it is treatable. You don't have to live with the curtains drawn. If it turns out not to be myasthenia, if it is just mechanical stretching of the tendon, aponeurotic ptosis, the solution is surgical. This is different from a cosmetic eyelid lift, blepharoplasty, which removes skin. This surgery actually finds the slipped muscle deep in the eyelid and reattaches it to the bone or cartilage. It tightens the elastic. It is a functional surgery, often covered by Medicare because it restores vision. The difference is crucial. If you operate on a patient with myasthenia gravis without knowing they have it, the surgery can fail or make things worse. You must rule out the medical cause before you attempt the surgical fix. I want to address the psychological impact of the sleepy look. In our society, we judge people by their faces. If your eyelids are drooping, people assume you are tired. They assume you are bored. They assume you are checking out. They might even assume you have had too much to drink. You might find yourself constantly raising your eyebrows to keep your eyes open, which gives you deep forehead wrinkles and a look of constant surprise or anxiety. This affects your social interactions. It affects your confidence. You stop making eye contact because it is physically exhausting. Reclaiming your eyelids is about reclaiming your ability to communicate nonverbally. It is about showing the world that you are awake, alert, and present. Let's talk about Upneek. You might have seen commercials for this. It is a new prescription eye drop specifically for drooping eyelids, acquired ptosis. It works by stimulating a different muscle in the eyelid called Muller's muscle. Muller's muscle is a backup muscle. It is controlled by the adrenaline system, not the voluntary system. These drops make that backup muscle contract, lifting the lid by about 1 to 2 millimeters. For many people with mild, age-related droop, this is enough to clear the pupil and restore vision without surgery. It is a temporary fix, it lasts about 6 to 8 hours, but it is a non-invasive option that is now available. There is another practical tip for those waiting for treatment: eyelid tape. It sounds strange, but there is special medical-grade tape, often used in Asia for cosmetic reasons, that can physically hold the extra skin or the lid up. It is invisible when applied correctly. For a senior who is struggling to read or drive while waiting for a doctor's appointment, this can be a safe, mechanical crutch. It holds the curtain open. Let's visualize the fatigue test. This is another way to check yourself. Look straight ahead. Now, look up at the ceiling without tilting your head back. Keep your eyes fixed on the ceiling. Hold it. Count to 60. If you have normal muscles, this is boring, but easy. If you have myasthenia gravis, your eyelids will start to drift down uncontrollably after about 15 or 20 seconds. You will see one eye start to close, then the other. You physically cannot keep them up. This fatigability is the smoking gun. I also want to mention the importance of sleep apnea. While sleep apnea doesn't cause the droop makes sleep apnea worse. Floppy eyelids are often a sign of floppy eyelid syndrome, which is highly correlated with obstructive sleep apnea and obesity. If you have rubbery, loose eyelids that flip over easily on your pillow at night, and you snore, you need a sleep study. Treating the apnea can sometimes improve the tissue health of the eyes. We often think of our eyes just as cameras. We worry about the lens, cataracts, or the film, retina. But we forget about the shutter. The eyelid is the shutter. If the shutter is broken, the camera is useless. So, here is your action plan. Step 1, the mirror check. Look at your iris. Is the lid covering the pupil? Step 2, the fatigue check. Look up for a minute. Do they fall? Step 3, the ice pack test. If they fall, apply ice for 2 minutes. Do they open? Step 4, the photo audit. Look at photos from 5 or 10 years ago. Is this new? Or have you always had it? A new, rapid drop is more concerning than a slow, 20-year decline. Step 5, the doctor. If you failed the tests, make an appointment with an ophthalmologist, MD, not just an optometrist. Or a neurologist. Tell them, I am concerned about ptosis and myasthenia gravis. Using the specific medical terms helps them take you seriously. Your vision is precious. Your independence is precious. Do not let a weak muscle steal them from you. Do not let vanity stop you from seeking help. This is not about looking younger. It is about seeing clearly. There is a world out there to see. There are grandchildren to watch. There are books to read. There are roads to drive safely. Open your eyes. Keep them open. And if they won't stay open on their own, get the help you need to prop them up. Thank you for listening. This information might seem niche, but for the person struggling to keep their eyes open right now, it is the answer they have been searching for. Share this with anyone you know who looks sleepy all the time. You might just wake them up to a diagnosis that changes their life. Stay safe, stay alert, and keep looking up.